Welcome to the University of Bedfordshire pre-registration midwifery course. So I'm going to talk through this presentation a little bit. It's a little bit challenging not being in front of you. However, I hope that I'm able to answer most of your queries and questions, and then I will obviously be available to answer any queries that you may have. First of all, my name is Carla Ball, and I am course lead for the 3-year programme here at the University of Bedfordshire. Women and their families remain at the centre of everything that midwives do. It's always going to be our focus, even through the university. We're all midwives that teach on the course and current still midwives, and we have to be registered midwives. And so women and their families and safety is paramount to everything that we do. So this is us, the midwifery team. So in the top we've got Anna, who's senior lecturer and works across all of the 3 years. We've got Bella down to the right there, who's one of our senior lecturers. We've got me there, Carla, and as I say, course lead for the 3-year programme. Then moving around, we've got Carolyn and Karen, both senior lecturers. Karen is the course lead for the 21-month programme, which I'll tell you about shortly. And then Kate and Meryl, both senior lecturers as well. So we're a small team of 7 of us, but we're a very close, tight-knit team. So the subject that we are going to be talking about today is the BSc Honours Midwifery Registered Midwife, which also leads to a professional registration as a midwife with the Nursing and Midwifery Council. So it's twofold. You'll get in the degree part of the programme, but also the professional registration. We run currently at the moment 2 courses. We offer the 3-year programme, which is the BSc Honours Midwifery Registered Midwife 3-year programme, and we also offer a BSc Honours Midwifery Registered Midwife programme, but this one's shorter. It's 21 months and it's for registered adult nurses already. So adult nurses that have gone into nursing have then decided that they want to come into midwifery, and they do a shorter programme of 21 months. And some of the teaching is occasionally combined, which is really good, and you will also obviously be working together out in practice. So we're going to focus a little bit on the 3-year course details. 3 calendar years, comprising at the moment 3 15-week terms each year, so a total of 45 weeks. And full-time study and practice for 45 weeks each year. You get 7 weeks holiday each year plus any bank holidays outside of the holiday periods, which are already allocated into your programme, and you tend to find that out around about the year, the academic year before. So usually around about probably the August-September time, you'll know your holidays for the rest of the year. Just thinking about holidays, 2 weeks are usually at Christmas. So the week before and the week after, or the week of Christmas and New Year. And then the other weeks vary because of trying to get everybody into practice throughout the year. They do vary, so the first years, the second years and third years tend to have different holidays. The only other time that you're all off together is at university closure dates, which is Easter. So Good Friday through till the Monday, and then the 2 days either side of that, so Monday, Thursday, Good Friday, Easter Saturday, Easter Sunday, Easter Monday, and then the Tuesday afterwards the university closes, so therefore you will also have those dates off as well. Just one more thing as well, just based on the course structure, we are at the university about to go through a course approval for a new programme. We were hoping that it would be ready for September 20, but with COVID things have been delayed, as they have across the entire UK with new course approvals. So we are hoping at some point in the next academic year that we will be able to transition to a new course, which will comprise of 39 weeks each year and slightly shorter third term, so 2 terms of 15 weeks and then a shorter term of 9 weeks. Holidays will be slightly different as well, because you will get you won't actually get holidays, you'll get inter-semester breaks, but the format and the structure of that is not yet confirmed, because obviously we have to go through an NMC approval event. Okay, so entry criteria. We require 5 GCSEs of grades 4 or above, which will include English and Maths, or equivalent of adult literacy or numeracy, and science with 2 others. Minimum of 112 A-level points in a maximum of 3 A-level subjects, not including general studies, for example ACC or BBC or 2 A stars. We also have accept access to midwifery courses with a distinction merit profile with a strong science and numeracy component. BTEC, again, minimum of 112 UCAS points and a distinction merit in the extended diploma. Evidence of recent study in the last 3 years, that's mainly because of the stepping into a degree programme requires an element of academic rigour, so we just want to be able to make sure that you're able to evidence that you have studied. Once we then review your educational qualifications, and selection is then by interview. So once you apply, you enter the selection process. We will then interview you. Interviews occur regularly from around about the October through to the April, so that says 2019, but for people who are looking to start next year, we would interview from, as I say, October through to April, and then the interview panel consists of midwifery lecturers, practice-based midwives, and also student midwives. Selection is quite competitive. We do have you know, a minimum requirement that we need to maintain for the professionalism of the course. You know, so you really have to come in and blow our socks off effectively. On the interview day, usually the presentation is done by one of the lecturing team and you get opportunity to ask questions. So I say normally it's this presentation, we normally be standing in front of you and you can ask questions as we go along. It's very similar to the open day presentation in that, you know, the questions might be slightly different, but the information that we give is very similar. We'll have third year students ready there to talk to you. You know, they will be able to give you the insights about accommodation, the finances, and what it's really like to be a university student, and, you know, a student midwife effectively. And then we'll take you into an individual interview where we'll ask you a set of questions. We ask some housekeeping questions that everybody gets asked, and then we'll do the interview questions. And then based on that, we then proceed to selection. We do reserve the right to offer immediate offers occasionally for those students who are particularly exemplary and sort of show real potential. We tend to offer those candidates within a week or two, but if we don't offer you a place immediately, it doesn't mean you haven't got a place. It just means we have to wait until we've interviewed everybody. So some people won't find out until the following April. Once we provide you with an offer, it's still subject to a satisfactory health check by the Occupational Health Department, and this is just so that we can make sure that we're able to provide any support that people might need to complete the course. You know, it's a fairly practical course, and, you know, we want to make sure that we have measures in place to support anybody that needs any extra medical support or health support. A clear DBS, which is the disclosure bar in service, so we have the police checks to ensure that we have the safety of women and babies in the forefront. Obviously, obtaining your relevant qualifications, so if you're waiting on A-level results or access course results, then we obviously need to make sure you get those grades before, you know, it's finalised. And also references, so we request a couple of references. Our suggestion is you make sure that you put somebody down who's actually going to respond and they know that you've put them down. We've had people delayed going into practice because the references haven't quite been ready. So some people kind of want to come on the course and then they get to the grades and it doesn't quite meet the entry requirements, so you know, or they've not been successful at interview. Does that mean it's all over, but you know, you really want to study? So no, it doesn't mean it's all over. It means that you do have options. So one of your options is a foundation year in healthcare, or effectively the first year of a health and social care degree. Gives you an alternative entry route to an undergraduate midwifery course. It gives you 120 credits at foundation level. So you could do the foundation year course and then the following year progress to midwifery, but it still depends on a successful interview and your level 4 equivalent of qualifications in English, Maths and Science. So if you need to get your maths, you then need to do the maths, for example, in that foundation year. Foundation year supports those returning to learning and who require additional help and support to upskill, or those who didn't quite meet the grades to pursue an undergrad course. Guidance and support, you'll get up to speed within 1 year and you will be ready to seamlessly progress onto an undergraduate study. You'll need at least 80 points with 64 points from 2 A-level passes at C or above equivalent, and then those are the units there that you will follow. And it kind of gives you a bit of a background into an introduction into health and social care, exploring different professions, so you'll get an insight into other professions as well, not just midwifery, you know, paramedics, ODPs, nursing associates, nursing, etc. And also looking at research and why research is important for healthcare. And you know, the academic skills as well, learning how to construct and write academic essays, etc. So that's a good base foundation. So the current midwifery programme, as I say, because we're kind of at the cusp of a bit of a changeover, but the current programme is 50% of the course time is spent in practice supported by mentors, which are now going to be called supervisors. Don't get too hung up on that, it's all kind of changing. 50% is spent in academic study, either direct contact or personal study time or guided study. So it's kind of split 50-50. Then the programme placement pattern, following a period of induction, students will usually have 1 formal study day per week, which might be directed study, a skills day, or actually a face-to-face formal lecture. You then have a personal study day per week, and in the first term, of year 1, you will be working in placement for about 15 hours a week with your supervisor, and then from year 2 onwards, term 2, year 1, your hours will increase to about 22.5, which is about 3 per week. This might vary very slightly with the new course curriculum, but at the moment this is how it sits. When you get to your final term of year 3, your hours will increase to 30 per week once you've submitted your final project. That can be either long shifts, short shifts, or rather traditional shifts of 7.5 hours, or the longer shifts, which are 12 hours. You follow the supervisor's rota. What we tend to do is we don't do a block system, so you're not in uni for 6 weeks and then placement for 6 weeks. We will see you every week, whether that's a face-to-face contact, it's directed contact. You have the access to lecturers every week, and also your colleagues. So for example, if you look at this table, a typical week in the life of a student midwife. So for example, on Monday you might have a study day, which is a lecture together with all of your peers for one of the units in the first year, which is the Women and Family Health unit, and it'll be around about 10 till 3 roughly, and it will be in Luton, in that room number there, PM06, and it will be Kate that's teaching you. Then perhaps on the Tuesday, you've got a personal study day. So you might choose to do that at home, you might choose to come in the library and do it, you might choose to do it in the middle of the night. It's entirely up to you. But then on the Wednesday, you've got a long shift on labour ward, which is 7 AM until 8 PM, and you're going to be in the placement hospital with your midwife that's working with you. Then the Thursday, Friday, you might have your days off. So it's up to you whether you do any studying, but they're effectively your days off, because then on Saturday and Sunday, you're working again. So on Saturday, you've got another long shift. So that would equate to 24 hours. So therefore, you've done your 22.5 hours that week. So you've kind of gained then an extra bit of a study day on the Sunday to meet with your peer group for forthcoming class presentations, for example. And you might meet in the student room, and you're meeting with your peer. Now, if you were doing, if a mentor was working traditional shifts of 7.5 hours, you would be working the Sunday, but you would have shorter days on the Wednesday and the Saturday, if that makes sense. Where do you complete your theory? Again, it varies. Study days tend to rotate around the sites, so we can try and share travelling. Room sizes have you know, a bit of an impact on that, depending how many students we take into the cohort. Majority of the first year tends to be in Luton, and the reason for that is because of the bigger classroom sizes. But we do occasionally teach over in Butteridgebury, in Luton, the Aylesbury campus, and also the Bedford campus. Currently we don't teach out of the Milton Keynes campus. Your personal study days can be used to meet, you know, wherever. So if you live in Aylesbury, you're not expected to come to Luton for a personal study day. You do that at home or in the library over at Aylesbury. All taught sessions are compulsory. The taught sessions are an enhancement, I guess, of your learning to some degree, because starting a degree programme, you're actually coming to read for a degree. So what we teach you in the classroom, and whether that's online or whether that's face-to-face, is the tip of the iceberg. That gives you the guidance to then go off and read more. And so if you don't attend the taught sessions, you miss out on the fundamentals of what you've actually got to learn. And by missing out on the fundamentals, you then lose the ability to apply the theory to the practice, which is what's crucial within midwifery. Because you need to learn that by doing something, why are you doing it, what's the rationale behind it, and what happens if it doesn't get done or it gets done incorrectly. So it's really important that you attend. And we appreciate people are sick sometimes and issues happen, but then it's up to you to be able to catch that back. We won't be repeating it. That picture on the left there is some of the students and what they're doing. They graduated quite a few years ago now, four-ish years ago, I think. And what they're doing is learning how to suture with some raw meat. We don't have elective units in this course. All units are compulsory, and all units have to be passed in order to progress to the next level. So, for example, you have to pass everything in year 1 in order to progress to year 2, and everything in year 2 to progress to year 3. You cannot trail any units across the course. So where do students practice? Initially we try and place you with a community midwife, and the reason for that is to try and give you a bit of a gentle insight and get those fundamental skills of abdominal palpation, listening to the fetal heart, doing blood pressures, checking urinalysis, and understanding the progress of pregnancy, and then the postnatal bit before we kind of send you into the hospital. We then rotate you round, you know, to the labour ward and the wards, and then in the second year, or on the new course, some of this will come into the first year. We also rotate you through emergency, accident and emergency, the neonatal intensive care unit, theatres, intensive care unit, because that allows you to consolidate the midwifery practice and also expand your experience and your knowledge of those women who need additional needs. We also offer the opportunity for a bit more specific special visits in some areas. So, for example, if you have a particular interest to go and work, for example, in top of my head, in the mortuary, and see how that works, then some students do choose to go there. Other students choose to go to fertility clinics. Other students choose to go into London to work with some of the fertility specialists. So there's always options, and also paramedics. Some of the students choose to go out with the paramedics. So you're based at one of 5 NHS trusts for practice, and when you come to interview you will be asked for your preference. Where's your practice placement area? And we will try our best to offer you a place at your preferred placement, but it's not always possible, because sometimes we end up being able to fill some of the practice areas much more than we can fill other areas, just because of where people live. What you need to consider when you're looking at your preference for placement hospital is where you're going to be living, because we don't want you living in Luton halls of accommodation and being placed in Aylesbury, because to get for a 7-hour shift across there, especially if you don't drive or you're using public transport, is going to be too much of a challenge. So you need to think about where you're going to be living in terms of your preference. If you're travelling from a distance away and you don't know the units, then it doesn't matter. You just say you've got no preference, and then we'll be able to slot you in where we can. The hospitals that we cover are Bedford Hospital, which is based in Bedford, Luton and Dunstable, which is on the edge of Luton and Dunstable, which is by the M1. Bedford and Luton and Dunstable have just merged in April this year to now form Bedfordshire Hospital NHS Trust. So they are now one trust, but with 2 sites. Buckinghamshire Healthcare NHS Trust is Stoke Mandeville Hospital in Aylesbury. Frimley Health NHS is Wexham Park Hospital, and Milton Keynes University Hospital is obviously based in Milton Keynes. So those are the 5 practice areas that we cover currently, and you will be placed in one of those areas. So there's some pictures of our current hospitals. Lovely units, really nice units to work in, and very supportive midwives that work there. With your practice experience, you must experience obviously the 24-hour cycle of care. Babies come Monday to Friday, you know, they don't come Monday to Friday 9 till 5. They are born excuse me, at any time of the day or the night, weekends, Christmas Eve, New Year's Eve. So you will need to experience that 24-hour cycle of care quite quickly. So that means doing shift work. So it might be that you start your shift in community, and actually the following week she's working a weekend, and you need to be able to work that weekend and to experience those shifts, because otherwise it's not reflective of the job that you're going to end up doing. You must attend full time to complete the required number of hours. We have a set number of hours that the course is approved by, which it combines the practice and the theory hours, and that's required by the NMC, so you do have to attend. So what that means is if there's any sickness days or any days where you don't have sudden childcare, for example, those days and those hours need to be made up. So you have to be able to catch up on the hours, and you know, have a plan in place to repeat those hours effectively. So it's important to keep on top of the hours. It's important to try and keep a track of where you are. So what will you learn? Lots and lots and lots. It's a very in-depth course, lots of anatomy and physiology, principles of midwifery care, the fundamental skills that you need to be able to provide midwifery care. Women's society, public health, practical skills, you know, the actual practical skills of delivering care. Also evidence-based, you know, research. Why is it important that we have research? Why do we need it in maternity care? The complexities of maternity care. So, you know, the women who have complex needs and are also having a baby, they sometimes need additional care. So it's important that we understand those complexities. Emergency management. Sometimes, you know, you're the first person to be able to have to deal with an emergency, so we teach you to deal with emergencies effectively. Pharmacology, you know, medicines, how to administer medicines, how to look for the effects of medicines, but also as well developing a personal philosophy. You know, we see students grow from sitting down on their first day in induction to the day that they graduate, and we see such a growth, and we see students develop their philosophy with what you think you start off with at the beginning of the course. You then end up becoming a completely, you know, enriched, reflective person by the end of it, because the experiences that you will go through on the course, the friendships, the journey that you go on will be one of a lifetime change. These are all done through workshops, lectures, discussions, simulation, reflection, seminars, you know, so there's a varying way that we teach on the course. And more recently we're learning the digital side of teaching, but you know, we will ensure that we cover all ranges of teaching and learning needs, in terms of making sure that everybody has an opportunity to have their learning style met. Reflection, what does that mean? You know, we can all sort of talk about reflection, but what we try and do on the course is get you to really think about you, and learning through your experiences. And as you go through the course, that will become deeper, and you'll find it sometimes challenging to reflect. Even as a midwife 26 something years later, you know, you never stop reflecting on the effect that you have on people, the impact that you have around you, and the care that you provide, and that's really, really important. So I'm just going to read this poem out to you, and this poem is called Chantal, and it was written by one of our students. Swaying slowly into the room, she sits next to me, a frail-looking girl of no more than 20. Her clothes far too big, vest top droopy to reveal her bra. She raises her head and looks me in the eye. "Help me," she whispers. "Please help me keep my baby." Her voice is just a croak. "I've got to stop this." She breaks down in tears. I cautiously close my hand around hers, unsure if my touch will bring comfort or unease. To my surprise, when she moves closer and rests her head on my shoulder, we sit like this for a while. I begin to tie knots in the straps of her top to keep it from slipping. "Thank you," she smiles nervously. I return her smile. "Would you like to see if we can hear the baby's heartbeat?" Only 16 weeks, yet her small frame allows me to locate the fetal heart easily. Her eyes widen and sparkle and her mouth breaks into a beautiful smile. "Wow," she whispers. "And all I see is love. Who are we to judge her?" So we use a lot of art, drama and poetry across our course, and we try and find ways where people can express themselves slightly differently. We have students that start at the beginning of the course not really knowing what a philosophy is, and by the time they get to the end they've actually worked out who they are and who they want to be and what type of midwife they also want to be. We have student midwife practice-based skills days, so one of your personal study days, for example, we might pull that and say, right, we're going to have an extra day in the skills lab and we're going to teach you how to suture, or we're going to teach you how to resuscitate, a baby, or give you a practice session. So we can kind of provide those extra days. How do we assess you? So we assess in both practice and theory related to each unit. So within each year you have different units that you are enrolled onto. We teach you the different elements of that unit, and then we assess you based on different assessments. Some of the assessments are in practice by the midwives, and they're assisted occasionally by lecturers, but generally according to a range of practice criteria. So those, that's done by you working in the placement areas, working in community with the midwife, working, on the labour ward, and they will assess you in that respect. The practice grades contribute to the classification of your degree after year 1, so only years 2 and 3, your practice and theory contribute to that classification. For the theory side of things, we assess you in different ways: essays, group and individual presentations, exams, vivas and OSCEs. Vivas are voiced exams, so you sit down and you talk to us and we might ask you some questions. OSCEs are observed, structured clinical examinations. So, for example, one of them might be on neonatal life support. So you would come into an examination setting, we would provide you with a scenario, and then you demonstrate your safety around that scenario and provide us with reassurance of your safety. And also written reflections. We have a reflective essay towards the end of the 3rd year which develops your personal philosophy that I was just talking about. A little bit about the NHS Constitution and the 6 Cs. So just a bit of a heads up before you come onto the course, and also potentially for interviews. It's worth having a look at the NHS Constitution and what it means. Benefits of studying at the University of Bedfordshire. Our stimulation facilities are excellent, and our preparation of you for emergencies in clinical practice are developed in the Skills and Simulation Lab. We have simulation lab on Pole Hill site in Bedford, the Luton site, and also the Aylesbury site, so we have plenty of opportunity. We do share the simulation facilities with all of healthcare, so sometimes we have to plan that carefully, and also it increases as you go through the years. Locally based experiences in a wide range of practice settings, like the many other courses. So we have obviously the non-maternity experiences to broaden your knowledge and experience, and we have the opportunities within each of the trusts for the experience into continuity of carer, and the Better Births model. In some of the trusts, the continuity of carer teams are working well. Some of them are having a few more challenges, but that's about the growth of the continuity of carer and making sure that we kind of work towards that model. As I said, there's a strong emphasis on the power of reflection to inform your personal and professional development, We're very passionate within the team that we have maintained, especially in the new course curriculum as well, we've maintained that element of reflection to try and ensure that we provide students with the ability to have that deep philosophical presence. And we're a friendly, enthusiastic team. We're really invested in you, and we believe in you, and sometimes we can see it and you can't. So sometimes we'll give you that little push if it's needed. Sometimes we will, just guide you in a different way to what you think you might need. But we are, we watch you grow, and so when you come to graduate, we're really excited. We're very passionate about making, helping you along your journey. And everybody has slightly different journeys, but we're there to help you, support you to succeed. So just a little bit about bursaries and scholarships. You could receive up to £2,400 at the very least. Every UK and EU student on a full-time undergrad course will at least get £1,500. So it depends on how much you're assessed on. Merit scholarships for undergraduates with an entry qualification score of 112 UCAS tariff points or more or equivalent. Scholarships is worth 2,400 over the 3 academic years. So I think the more UCAS points you get, the higher the scholarship, grantees that you get. All undergraduates with an entry qualification score of fewer than 112 UCAS points or equivalent, the bursary is £1,500 over the 3 academic years. So that's an extra £500 a year. The university also offers practical support to students who get into financial difficulties. We have various funding streams, we have various, not scholarships, hardship funds and things that students can apply for should they come into difficulties across the 3-year programme. Go Global initiative. We have an initiative here with the university which takes students to health campuses across the globe. So we've had students visit China, to look at the extensive healthcare facilities they have there and the birthing experiences over there. And it's really, really well received, it's very well supported, and students get a very large discount for this trip, so students are eligible to apply for that. iCare. So the iCare Merit Badge Award scheme is designed as a way for patients and relatives to say thank you to a student if they think the student has cared for them in accordance with the iCare pledge, which is below, and it provides midwives, mentors with a way of commending student performance. I will be empathetic, compassionate and patient in my approach to others. I will be respectful of their needs, and when necessary I will escalate concerns appropriately with advocacy as my only motive. So when students receive praise from mentors, it's amazing, but when they receive praise from a patient, it's even more. So this is specifically just for University of Bedfordshire students, but all healthcare students, so nurses, paramedics, ODPs, child nurse, mental health nurse, nurse and associate, occupational therapy. Every healthcare student is eligible for the Merit Award scheme. We have a conference every year where we present the awards to those students. Practice in a safe environment. The simulation facilities allow you to make mistakes. That's why we want you in the skills labs and in that simulation, so that you have the ability to make those errors before going out into practice and have that safe environment. Just a couple of pictures there of our skills facilities, and then a couple of images of our campuses. So this is the Luton Park Square campus and the postgraduate centre and the accommodation down at Luton, and part of the postgraduate centre as well. That's Puttridge campus, so we occasionally teach there, and we try and have your kind of ultimate graduation final day with us as lecturers. We have there. Some of the accommodation, so that's the accommodation at Stoke Mandeville Hospital and the student village room at the Luton campus. That's where we graduate you. So this is St Mary's Church in Luton, and when you graduate, as I say, we are very proud, so we're upstanding and we cheer the loudest. We have a bit of a reputation as midwives to cheer everybody on really loudly. And that's some of our graduates from last year. So on the left there, that's our 3-year programme that graduated. who are now all midwives, and will, you know, be looking after you, possibly as midwives. And then on the right there, that's myself in the middle in the blue dress with our 21-month programme students. These were all nurses that graduated and are now working as midwives also. So I will be available for questions on the time allocated to you. So I hope that that's been informative, and look forward to hearing from you. Hopefully see you soon. Thank you very much.